actually pretty boring. I'm sure it's whatever, so it's fine. And I gave a speech this morning at noon at the Des Moines Rotary Club on health care, which I think we all know is probably the most important issue domestically that faces our country today, not because we don't have quality health care, but because of the skyrocketing cost of health care. Before I go much further, I have a daughter with me whose name is Megan, who's over there. You see in the blonde hair. She recently graduated from that conservative Institute of Higher Learning, Columbia University. She was not there to meet the president of Iran. I'm sorry to say. I know sorry you missed it, aren't you? Anyway, and basically what we need to talk about is how to keep the cost of health care down and make it available and affordable. And we've got to have people moving from one job to another to be able to keep their health insurance. We have to make sure that medical malpractice is reformed so that doctors won't perform additional tests every time you turn around for fear of being sued. And we have to shift the employer benefit to the employee. And we have to give every American a $2,500 tax credit to help pay for their health insurance premiums, in the case of a family, $5,000, because it's obvious that there are 47 million Americans without health insurance in America today. I would remind you that the best health care in the world is in the United States of America. The key is to make sure that every American has the capability of receiving it, which means we have to make health care more affordable, available. And again, Medicare, in case you missed it about 3 days ago on the front page of one of our national newspapers, the inflation was 10% last year. You have that kind of inflation on health and health care, you're not going to be able to afford, nobody's going to be able to afford it for the time. So I know it's an issue of great concern to everybody, and I'd be glad to talk about the war with you, or I'd be glad to talk about anything with you, that the tuition that I paid for my daughter at Columbia University, I'd be glad to talk to you about great sorrow. But anyway, so if you got any questions or comments for me, I'd like to respond to it. Sir.
Thank you for your service to our country.
Thank you.
I have diabetes. My brother has very advanced Parkinson's. Just found out he's been diagnosed with Alzheimer's. Your views on stem cell research would seems to give me and my brother hope.
Thank you for that question. The question was that the gentleman has been diagnosed with diabetes. His brother has Alzheimer's, and we know how terrible both of those diseases are. And my views on stem cell research. I'm pro-life, and I'm proud to have had an unwavering, unchanging record of being pro-life for 24 years. And it's a tough issue for those of us in the pro-life community. I think the Bible also tells us to heal the sick. And I believe that the potential of stem cell research is immense, after a lot of thought and prayer, that we should fund federal research on stem cells. I would remind those, and I understand the debate, but those embryos that are going to be used are going to be kept in frozen perpetually, or discarded. So, smart people I know, and you know, believe that stem cell research has the great potential of curing some of these terrible, terrible diseases that afflict Americans today. So, that's my will be in our prayers. God bless. Thank you. Any other question or comment? Or insult? Sir.
Comment. The SHIP legislation that they've been talking about?
Yes, sir.
How did you vote on that?
On the S-chip reg...
It's called Hawkeye here in Iowa, I believe. It's the same.
Yes, sir. They wanted to increase the funding by $35 billion. Even in Washington, $35 billion is a lot of money. And they wanted to expand it to adults and 300% of the poverty level, up as high as $80,000 or $90,000 a year, you would be eligible for it. Now, one of the reason why I was opposed to it, their proposal to pay for it was to increase the tax by $1 on a pack of cigarettes. So on one hand, we're going to provide health insurance for children, but we want them to smoke. I don't get that. I really don't. I've spent a lot of my time as a former smoker trying to reduce tobacco use in America. You've got to pay for these things, number one. Number two, it's too great an expansion. And I think the President's proposal was to increase it by $5 billion was entirely appropriate. There's several million children that are still not covered. One of the reasons why some millions of children are not covered is because they haven't signed up. So I would be devoting a lot of my efforts to identifying those couple million children that are not signed up and sign them up. So I understand how emotional this issue in some ways is, but I'm not going to support any expansion in government unless I'm sure that it's paid for properly, because I'm not going to do that to these young Americans. On the Medicare Part B, the Medicare prescription drug bill, we laid $800 to $1 trillion unfunded liability on the next generation of Americans. I don't think it's fair to them. So that's my position. And I understand, like some other positions I've taken on other issues, it's not the most popular. But I think it's right.
Speaking of that, I assume you're alluding to Iraq in your last
Yes, sir.
comment. I have a couple of questions related to that. One is, how much is your support for the surge guided by your own experience 40 years ago? And I've also wondered, as I've watched you over the years, how much of your experience back then is in your life today, both in your captivity and your thoughts, and even in your dreams?
My support for the surge is based on my belief that a date for withdrawal will lead to chaos and genocide. And other nations in the region who are not our friends would gain significant influence and power. The president of Iran a couple weeks ago said, Americans will leave Iraq and it will leave a vacuum and we will fill it, we Iranians. I'm not sure we want the Iranians to be in control in Iraq.